Hi, good one. So my name is Victoria Olaniyan. I'm from Aston University in Birmingham. So I'm really happy that I'm going after Peter and Joe because it really sets the scene for everything I'm about to talk about. So my PhD is based on the mental health and help seeking amongst ethnic minority university students. And that is the working title of my thesis. Is it that way? Which one? Which way? Which one?
It's that.
Yeah. Okay. So this is just a quick outline of my presentation. So a bit of a whistle-stop tour through everything. So talking about the background, about this topic, ethnic minority students and their mental health, the aims of my study, the methods, findings, and expected outcomes for the project, and a little bit of time for a Q&A at the end. Okay, I think I keep on pressing the wrong thing. Okay. So student mental health, as a lot of us are probably aware, that the university environment is increasingly presenting a number of challenges to the mental health and well-being of university students. So these challenges can either worsen pre-existing conditions or contribute to worsen pre-existing or create new ones. So challenges such as academic pressures, financial difficulties, loneliness, and just other issues that we do know young people go through. So in the United States, Australia and United Kingdom, there have been reports of rising levels of mental illness in the student population. And in the UK, there has been a 79% increase in mental health related deaths between 2008 and 2015. And if you've been keeping an eye on the news, in some universities not too far from here, that has been, over the last 18 months, there's been 18 student deaths due to suicide. So that graph there just shows the rising rate. So from 2005 to 2016, you can see that the rates have almost doubled for student suicides in UK universities. So current research and policy considerations, as we've been hearing throughout today, that there is a lack of quality research amongst about young people and adequate policy consideration, especially on student mental health. So I'm currently conducting a systematic review alongside my supervisors, and out of 200 studies conducted in high to middle income countries, only 20 of them were conducted within the UK. The UK government's mental health strategy policy plans, such as the 2016 5-year forward plans, talk about young people in a blanket statement, but they do not really mention student population, despite them being at an age that they're susceptible to developing mental health problems. So a report by the Institute of Policy Research last year, they reported that there's been a growing demand for universities' counselling services. So 94% of universities are now reporting increases in counselling services. 61% have been reporting increase in need for over 25% of their services. However, there's still variation in the way the universities are dealing with these problems. A lot of the universities aren't fully equipped to deal with them adequately. So, for example, 29% of UK universities, only 29% of UK universities have a defined mental health plan and a wellbeing action plan. Less than 50% design courses to help improve mental health. 67% do not actually provide students with NHS specialists on campus, and 25% don't actually work with any NHS secondary services at all. So, but there is a specifically vulnerable subpopulation within the university environment, which are Black and ethnic minority students. So most of the literature that informs my work is US-based due to the lack of studies conducted within the UK that I've mentioned previously. But research shows that Black and ethnic minority students are more likely to suffer from mental health problems and more likely to report them, but they're less likely to seek any professional help. So this research is consistent with research done with the general BAME population within the UK, so with the adult population, so more like first-generation migrants. So where they are 75% more likely to develop serious mental health problems and less likely to seek help, and 56% more likely to be detained under the Mental Health Act, which is quite shocking. So again, current research and policy considerations for Black and ethnic minority students. There's a lack of academic and national policy concern. So again, out of another review finding, so out of 150 studies talking about ethnic minorities and their mental health, less than 10 of these studies were conducted in the UK. So Thankfully, due to third sector and voluntary sector research, we do know that Black and ethnic minority youth and young people in general are underrepresented in primary care services, but they're overrepresented in emergency and involuntary care services, which shows that this group does need support and they do genuinely suffer with these problems, but they only receive the help when they've reached crisis point, which is shocking. So reasons for this have been fear. Reasons that have been proposed in the research has been fear, negative experiences, lack of awareness, stigma, or misdiagnosis. However, the research is inconsistent and inconclusive, especially within the UK, possibly due to the lack of research that has been conducted. So that's where my research comes in. So aims of my study is to kind of try and fill in this gap and add to the currently limited research. So exploring the views of Black and ethnic minority university students, looking at the barriers and facilitators to their help seeking. And I'm also interested in evaluating a range of social, cultural and environmental factors. So terms such as stigma, acculturation, generation status, migration status, religion, factors relating to the university environment that I'll talk about a bit later on. So it would be qualitative methodology, so I'll be interviewing students, university students. That's mainly because the current studies that we do have are quantitative based, so giving students surveys that kind of restrict them to predefined answers. However, due to this type of topic, it will be better to give the students a chance to explain their own experiences in their own words without kind of enforcing yes or no answers upon them. So data will come from students from Black African groups, African Caribbean and South Asian groups. I'll be interviewing only home students due to there has been a lot of research with international students, but not a lot with home students. So I'll be focused primarily on them. So I'll be conducting the research in 3 universities in the UK. So I'll be focusing on factors relating to the university environment. So 2 factors that are really important to me are ethnic diversity and university prestige. So there's been a lot of research within the UK, some of Peter's work actually, that talks about ethnic diversity, and if you're in an environment where people look like you, you're less likely to develop mental health problems. And also research with the more prestigious a university is, the more likely you are to suffer with mental health problems. That is mainly in the US, however, no research has been conducted in the UK. So especially with if you've been following the news, you'll know that there's been a lot of news about Oxford University, Cambridge University trying to widen participation to ethnic minority students. However, how prepared are these universities to accept students that already have pre-existing mental health problems, knowing that Russell Group universities, the white students already suffer with mental health problems there anyway. So 3 universities, so a Southwest Russell Group University that has a population of less than 10% of ethnic minority students, an East Midlands University that has a population of less than 30%, and a West Midlands University that has an ethnic minority population of more than 60%. So as I mentioned before, I'll be conducting semi-structured interviews, so from topics such as students' background, their migration status, experiences with mental health and well-being, their identity, their mental health status, perceptions of belonging to the university, and awareness of services. Data analysis, I'll be using grounded theory. However, I won't go into that too much, so if you have any questions, you can ask me at the end or catch me up later. So I've already been to the university in the Southwest, so 3 main themes have come up. So first theme is stigma and shame. Second, double discrimination. And third one is fear of the unknown. So the first and the third one are quite self-explanatory. However, double discrimination is something that's been really interesting. So the students that I've interviewed have said, okay, the fact that they're an ethnic minority is something of discrimination anyway, especially due to that they're in a Russell Group University, and the fact that they have a mental health problem is also a thing of discrimination. So these 2 aspects of their identity conjoin to make them avoid help seeking. So that's been quite interesting, and I'm looking to probe into that a little bit further with the other universities. So the next step is to go to the university in the East Midlands and the West Midlands and continue interviewing students in this Russell Group University. So expected outcomes, so hopefully to add new evidence to the current literature, inform the designs of support services in universities, because majority of the universities in the UK don't actually have any support specifically to ethnic minority students. There's a lot of talk about culturally appropriate services, but most universities don't actually have anything in that respect. So contributing to the mental health understanding, and most importantly, I need to provide the participants with a voice and empower them to be able to engage with their own mental health and well-being more appropriately, and try and destigmatize this kind of area. So yeah, that's it.
Great, thank you very much, Victoria. We're sort of pressed for time, so we've got time for one question. Anybody got a question? Otherwise, we'll move on to the next speaker and maybe take questions at the end. One question over there.
Hi. So you talked about from your findings, one of the major themes was the fear of unknown. Could you specify or further elaborate what is that? What kind of
fear of the let's drop now. So, yeah, can you hear me? So fear of the unknown is more of, they don't literally fear of the unknown. They don't know what to expect when they do seek out mental health services. So due to the increased rate of sectioning under the Mental Health Act, a lot of people know people that have been sectioned and said, okay, I'm not going to tell the student services just in case the same will happen to me. I don't want to be put under medication, so I don't know what kind of support I'll get. I don't know what counselling is like. I'm not going to be counselled by someone that isn't from my ethnic group. So these kind of topics have been coming out.
Okay, thank you. So we'll move on to the next speaker, Ghazal Amir, who is going to talk to us from University of Leeds. He's going to talk to us about a research agenda which incorporates ethnicity and religion.